Dr. Dearing here. Today we're going to talk a little bit about conquering allergies. It's that time of year where everybody starts getting exposed to pollen and getting the nasal discharge and the sneezing, and so it seems to be pretty prevalent, especially here in Chattanooga. So I'm going to talk about some of the different things that we can do here, but I'm trying to narrow it down to a few supplements that we really want to focus on. First of all, what are we talking about here? We're talking the allergy problem, what's happening. Our body's basically overreacting, having an immune response, and you have different systems in the body. You have a Th1 and Th2, a type 1 and a type 2 T helper system. If it gets a little bit off balanced, then you end up with too much type 2 helper system going. You are going to get histamine released from the mast cell. Once you get that, that's where you start to get all your symptoms. And once that histamine's released, the cat's kind of out of the bag. So the best thing to do is prevention. If you could start on things beforehand, it's great, but because once histamine's out of the cell, it's gone. What you're doing at that point is trying to prevent future histamine from being released. And coming from the pharmaceutical world that I was in 30 years, I often recommended either over-the-counter or prescription antihistamines, and never really thinking about, or actually never really knowing that there were alternatives in the natural world, which I wish I would have known about then. And because I used to take some antihistamines myself, matter of fact, just not liking the fact I was on a over-the-counter pharmaceutical, I wasn't always comfortable taking them. Sometimes I used the nasal steroids. They say use those every day, but you really can get away with taking those like just one or two times, and it actually is very effective. But I didn't know what I didn't know, which was a whole beautiful world in the nutraceutical world that can treat these things. And that's very important to know, because the over-the-counter antihistamines, the prescription antihistamines, pharmaceuticals, can actually, some of them cause some irregular heartbeat, some of them can lead to brain fog, cause some brain fog, and some can contribute to dementia. So for your older people, that's not a good way to go. So it's nice to have these beautiful alternatives. So our symptoms, as you see, we know they're going to be sneezing and mucus discharge. A lot of post-nasal drip can be a big problem sometimes and causing a cough. And some people get sinus pressure and headaches. I don't get much of that. But some of the things that you can, there are probably 10 different things you can think of that are going to help with allergies. Vitamin C and bromelain, quercetin, barber. But we are today going to focus on the one I think that are the best. I always like to get to the root cause of problems. So instead of just treating some of the symptoms, which even some of our nutraceuticals do, if you can actually prevent the histamine from being released and go to that, then there's two things I'm talking about today, quercetin and stinging nettle, that will actually do that. And then also, as a great preventative, is to desensitize people. And we have, you can do that with local honey. And we have out in Harrison Bay, which is about 10 miles away, we have a beekeeper that provides us with our honey here, and we sell it at Nutrition World. And it's selling very well right now because of the fact that this seems to be a worse year than usual with the pollen. But back to the presentation, quercetin, it's nature's mast cell stabilizer. We call it the flavonoid hero. So quercetin is something that's naturally found in a lot of the things that we eat: apples, onions, berries, cherries, broccoli. There are a lot of different things in nature. If you see something that's got a lot of color to it, usually what you're seeing in there is the quercetin is a part of that color. So, but very good at stabilizing the mast cell, which of course will result in reducing histamine. Quercetin is unbelievable in the number of things it can do. It's the cardiovascular health, the ability to lower blood pressure, the ability for it to boost your immune system. Quercetin is a zinc ionophore. That means it can open up the channels and allow zinc to go in, which can keep a virus from replicating. So it's good to take this. For me, that we have at nutrition world, we have the Core 4, and I have what I call Dr. Dearing's plus 4 more. Quercetin is on that because it's good for so many things. It's such a great antioxidant. I could literally list off about 10 different positive things it does. You can come see me at Nutrition World if you want to talk more about that. But back to its role that quercetin plays in preventing the histamine from being released and the use of it for allergies. And I got into that because I was talking about the dosing. You can usually get away with 250 milligrams a day for most purposes you're going to use it. But when you're getting close to the allergy season, so getting into March, early March, you probably want to start loading up a little bit more on your quercetin at 500 milligrams to 1,000, especially when you get into the pollen season, which would be more like April and May. You would want to be taking maybe closer to 1,000 milligrams a day. So what is the science behind quercetin? Well, comparing it to some of the prescription medications like cromolyn. Cromolyn can be given in an eye form or a nasal form over the counter, but for prescription, for oral purposes, taking it's actually a prescription medication, and there's been comparisons done, and it actually outperforms cromolyn. Stabilizes mast cells, preventing release of histamine. It balances that immune system that we talked about between the helper cells, the Th1, Th2. It inhibits IgE antibody formation, which we know IgE plays a big role in the immune system. And it reduces inflammatory cytokines and mediators. Now, moving on to the other supplement, the other nutraceutical that's beautiful for allergies is stinging nettle. Quercetin, great for preventative, building up. Stinging nettle is actually good for providing rapid relief, so you can actually take it sort of as needed. Sometimes people can even get away with taking it just every other day or taking it for several days in a row and then waiting to see if the symptoms come back. But stinging nettle is beautiful, and we've got lots of our combination products at Nutrition World will combine stinging nettle in with quercetin and with other things, and I'll show a couple examples of that here in just a little bit. The dosing, well, first of all, it works also by blocking histamine receptors, and so that's a little bit different. You're not having the mast cell and keeping the histamine from being released, but you're actually blocking the receptors. And it reduces prostaglandins, which are also known to cause a lot of swelling. Dosing is at 300 to 600 milligrams, and you can take it as needed, as mentioned. This one, studies have shown that it actually matches Zyrtec, and you don't have the drowsiness that you can sometimes see with Zyrtec. And these studies that were done, basically instead of doing sort of a placebo and a comparison direct, they basically just did questionnaires with patients and said, which one did you prefer, or which ones did you get symptom relief from? And the stinging nettle matched up right with Zyrtec as far as symptom relief from allergies. Now, moving to the third thing we're talking about today, which is local honey. We call it the sweet sensation, no desensitization. So some people will say, does it really work the way they say? The theory behind it, of course, is that you're going to desensitize because you're going to have the pollen, the local pollen that you're exposed to is going to be within the bees having that. And so by exposing the body to it in small amounts, you are going to be desensitized to it, and it's going to decrease your symptoms. And there's a lot of anecdotal evidence of this. You'll hear people talking about it all the time. The naysayers, if you want to give them any benefit of the doubt, you can at least say, hey, if nothing else, these things are going to help you with a sore throat. They've been known to boost your immune system. They have antibacterial effects, anti-inflammatory effects, and in a lot of cases, some people just replace it as their sweetener. Shouldn't be on artificial sweeteners anyway. This can replace that. And it doesn't have a very high glycemic index, and it's a small amount you're getting when you're only taking basically a teaspoon to maybe 2 teaspoonfuls. You can mix that in with your coffee or your tea. And so, yeah, moving on beyond supplements, just to tell you a little bit about ways to approach this. You can layer therapies for maximum impact. I'm going to talk about some of the products we got where you can actually use different things together. You can use the honey with some of the other products and try to go at this at the, from a multi direction here. And if you, basically what you're doing is try to figure out what works for you. And, I didn't even know. I started taking quercetin back during COVID, and I was taking it for its zinc ionophore purposes, and lo and behold, I noticed that it was improving my allergies. I had no idea it was good for allergies. And same thing, a guy I work out with, I got him set up with a bunch of supplements to try to improve his health, and he called me or texted me and said, my allergies aren't as bad this year. What's up with that? And I said, didn't I recommend quercetin to you? And he said, yeah, you did. And I said, well, that's what's keeping you from your allergies from being worse. But even he and myself both in the last week or two have had to add on to that a little bit, because quercetin by itself, we were still getting a little bit of symptoms there. So we've added on to that, and we're trying to figure out what works for us. And some of the products that I'll talk about we added on that has the stinging nettle in with it seems to be the answer, at least in my case it is. We have lots of stuff at Nutrition World. One of the things, if you would rather not have another capsule to take, we do have a liquid form. This is a local company called Buried Treasure. It's called Allergies, and it has the quercetin in it. It also has the stinging nettle in it, but it also has vitamin C and bromelain. Both will help the absorption of the quercetin that's in there. Has all kinds of bayberry, eyebright, mullein leaf, so many beautiful things that this is going at it from multiple different angles. Probably can't go wrong with this Buried Treasure Allergies. Then there is a pharmacist, a Dr. Dubois, who kind of was a precursor to me back in 2004, it looks like. He was called himself an unbeliever in the nutraceutical world. I wouldn't call myself an unbeliever as far as the nutraceutical world. I would call myself somebody who just didn't know what I didn't know. If I did know much about nutraceuticals, it was like, yeah, that's kind of cool, but pharmaceuticals are superior. Little did I know that, all your pharmaceuticals pretty much have, whether you even know it or not, usually have some kind of side effect. Since I've been in the nutraceutical world, I've learned that most of your nutraceuticals have side benefits. It's like quercetin. Not only is it helping with your allergies, but it's also helping with so many other things. So the side benefits part. But this guy, Dr. Dubois, hopefully I'm pronouncing his name right, he kept having people come into his pharmacy and ask him about natural remedies, and eventually he just started looking into it more. And now he bought into it so much and is passionate about it now that he started his own company. He created a hybrid AR that we sell at Nutrition World. It has rapid nasal and sinus support. It has quercetin in it, of course. It's got butterbur in it, which is another one that's really good, Panax ginseng, echinacea. So kind of going at it from several angles here, from your immune system to antihistamine. So, but anyway, interesting though that another pharmacist that has entered into the nutraceutical world and actually has his own product that we sell at Nutrition World. Another one that kind of is a good combination is this Etsy company, Allergica Seasonal Support. It has quercetin, stinging nettle in it, and several other great things. A little bit of N-acetylcysteine in there, which is always good to have. Great product right here that I've actually been using some lately. And then the last thing we'll talk about here is the local honey. And we have been selling a ton of this lately at Nutrition World. And we know that it's from 10 miles away, so you are going to get your local pollen in there and hopefully desensitize, but nothing else. This stuff is absolutely delicious and highly recommend it. So, thank you for your time, for listening. If anybody wants to come by Nutrition World and talk about any of these products, or if you're on a ton of pharmaceuticals, most of the time I will address allergies. When I see that you're on a pharmaceutical and I'm doing a consult with you, I will address that and say, hey, do you realize that we can probably have you off this pharmaceutical and find you a nice natural one that's also going to happen to help treat about 3 of your other disease states, sometimes that being blood pressure being one of them. So anyway, I appreciate your time, and until next time.